know when you're ready. I'm Nancy Hutchinson.
I'm Logan Ziegler.
And I'm Jordan Lacey, and our topic is on physician-assisted suicide, and we're open for questions.
Why don't you just tell us, how would you define physician-assisted suicide? What are we talking about?
So physician-assisted suicide is when a patient is suffering from a terminal illness and they feel like they're kind of a burden on others, so they're going to want to end their life, but it's through medicine that a doctor gives them.
What kind of approach are states taking to this, or the federal government, as far as laws that are in place regulating physician-assisted suicide?
So the Supreme Court said that we do not have the constitutional right to kill ourselves, so they left it up to states. So as of right now, 5 states have it legalized: California, Washington, Oregon, Montana, and Vermont. And they all kind of follow like the same procedures and guidelines, except for Montana, who instead of it being like physician decided, the courts start to decide and go through a process with that.
What's the difference between physician-assisted suicide and euthanasia? What's the difference?
I got this one. So euthanasia, or physician-assisted suicide, is kind of like a form of euthanasia, but euthanasia is when a doctor or health provider also like kills the patient, but it can be with their permission or without their permission, and it doesn't have to be through the liquid that physician-assisted suicide does have to be. So this one could be like a needle or something like that, or something different, but it can be without the patient's permission to do so.
So euthanasia is the doctor doing the actual applying of the medicine or whatever,
Yes.
and the physician-assisted suicide, hey, they provide it, but the patient
Has to
initiates.
request it.
Okay.
And it has to be like a bunch of different requests. Like they have to start off with a oral request. They have to say they want to die, and then they have to have a written request, and then they have to have a 15-day waiting period, and then they have to say again that they want it to happen.
That's in these states that it's legal? So
Yes.
there is a
It's all
15-day
the
waiting
same.
period,
Yes.
so
Yeah.
they have to really consider it. Do any of the states require, like, to see a licensed counselor or anything like that?
The only thing is that the doctor has to talk to another doctor, and the second doctor's opinion is the one that matters the most. They have to say, yes, you can go through with it in order for it to happen.
There also has to be 2 witnesses to the verbal asking of it, one that's not a family member or a licensed physician.
Okay. And one is a one is a family
One
member?
can be a family member,
Okay.
but not a licensed physician.
Okay.
Well, I'm just wondering, as you talk about most of these are terminally ill patients, do they have to be
Yes.
in order to qualify for physician-assisted
They have to
suicide?
have 6 months or less to live.
Okay, why is that?
I think it's mostly just because if they had anything longer than that, then there could be some sort of hope that will come up for them to live like a long time.
In your opinions, I would like to hear from each of you, is that a good rule to have? I mean, why can't we just open it up and say, you know, you can make the choice. You don't even have to have a hangnail, you know? You can just say, I'm an adult, I can make this decision and end my life. Why is that? Or what do you think?
What's
on
the
it?
question?
So what do you think, why is there a government interest in regulating that someone has to have 6 months to live or less in order to qualify for physician-assisted suicide? Why can't we just say, if an individual wants to do it, they do 15 days, they think about it, they counsel with somebody, why can't they make the decision, whether or not they're terminally ill or not?
Well, I think there's so many people like in America that you see that commit suicide, so the government has to have a regulation on it, so they feel it can be somewhat right to have it 6 months to live. So it's like they're gonna die anyway. So, you know, the government feels if they can make that choice to kill themselves, then it should be their choice to do it.
So the government shouldn't. So your question was, why do we not just allow anyone to kill themselves? Correct.
Right. Why would the government care? You know, I mean, it seems to me, and to your point, Gypsy, that individuals are committing suicide anyway.
Right.
So wouldn't it be better to have a doctor involved so that it's smoother, it's more humane. I mean, all that sort of stuff. So if somebody really wants to kill themselves, why can't we? Why would the government want to stop that?
Usually in cases like that, there's some sort of mental illness that this person's not controlled, like they can't control like these thoughts or something like that, that maybe counseling or some sort of medical procedure, or not procedure, but pathway could help them get off that, these ideas that they want to die. But with the terminal illness, like you're on, you have that 6 months and you're going to die anyways.
Yeah, the patient also has to be mentally stable too. So they have to be like diagnosed, like they know what they're doing, and they have to be able to take it themselves. They can't be on a feeding tube and the doctor like puts it in their feeding tube. They have to be able to drink it themselves. It can't be any other way from that.
So what if someone were on a feeding tube, like they're in a vegetative coma, and maybe we don't know how long they have to live? They can't consciously make the decision. Are family members able to make the decision?
Well, that plays along with more of euthanasia and how if someone's not, if they're unconscious, then that plays into a bunch of legal things, and that doesn't really go with assisted suicide. They have to make that decision. They have to be conscious for it, and they have to take the medicine to do it.
That's a totally different.
Yeah.
So is euthanasia allowed anywhere in the U.S.? Did you find that? No.
It's illegal.
All right.
How are other countries addressing physician-assisted suicide?
Switzerland has like the longest history. In 1940, they made it legal. Belgium, Netherlands, and Luxembourg are three countries that have it legalized, and just recently in 2016, actually Canada made it legal.
And is it similar systems where terminal illness only, similar to what the U.S. does?
But the guidelines for Switzerland is that you don't have to be a citizen of the country in order to be prescribed the medicine that will kill you, the lethal dose. But for Belgium, Netherlands, Luxembourg, and in the states of the U.S., you have to be legal residents
Of that state in
of
order
that
to,
area.
yeah.
So I couldn't be terminally ill and say, like, move to Washington.
If you
You
moved,
could. If you're a legal resident of that state, you could.
yeah.
What makes you a legal resident?
I think if they have it defined as if you live there, have a house, or your residency.
Have a job.
Yeah.
So from, he was asking the question about the government, why would the government care? Why do they want to regulate that? Which maybe goes a little bit deeper than, maybe there's a value of life that our government has. But as a Christian, a biblical worldview, what would you have to say as to why you would be for or against, someone being able to choose to end their life for whatever reason?
So, as a Christian, you have to look at it as God has made us to where we each have an individual plan, and you should live out that life until you die, no matter when that is. You shouldn't end that early or, mess up God's plan. In 1 Corinthians 15:26, it says that death is an enemy. In Genesis 2:7, it says that life is a sacred gift from God. So, each person has their own personal opinion of it, but in a Christian perspective, you should value life and value God's plan, so you should, look at assisted suicide.
Like, is there a difference between, so you have a patient, they're weeks away from dying, the things have started happening in their body, they can no longer eat, their digestive system is shutting down, a lot of pain, and so now the medication is, and so they're in extreme pain, and so either they are medicated where they can't actually think, or until that process takes them, or they're saying, hey, I'm cognizant now, can you just end it now so that I don't have to go through whatever my body's going to go through the next 2-3 weeks, and I'm not even going to be conscious, and I don't want my family to see that. Is there room in your minds for that? We do that for animals. Is there a difference between animals and humans? One, and then if there is, which I'm interested in what you think about that. Should we allow that? Is that mercy? Is that loving? I'd like to know your thoughts on that.
So like you compared, animals and humans. In an animal, in humans, it doesn't just affect that person, it affects many different people. So, you know, you have to be selfish in thinking of that person and the pain that they're going in, and you, in a way, you have to let them make that decision, but, you know, you can do your best to talk them out of it and, you know, hope that they live to help you and them. But like you said, in animals, you know, yeah, they have a conscience, you love your animals, but it only affects them, it doesn't affect a lot of people.
With humans, by choosing to end your life this way, it's kind of robbing the people that are close to you of the times, those last breaths, those memories up until your death. It just kind of puts it on broad soccer things. I don't think that's fair.
Yeah, and God like has that unique timing and the miracles he can perform. Like we've seen before in the past in the Bible, like he might use this special story to let you live longer and then have some other effect on somebody else later that you wouldn't know of. And if you ended your life, then you'd be taking away a miracle God could have.
Also, to add on to that, even if you're going to die and God doesn't give you that miracle, through that suffering, you can still do stuff with that to like help other people. So that's it.
Do you guys think that these Christian principles have an impact on the laws? Like, do you think that's why we have some of the laws that we do?
I think it might be why some of the people that implemented the laws are thinking about it, but I don't know that has like an overall, like for sure impact. The people might be thinking about it that way, but
Yeah, I definitely think the people that made these laws,
might be conscious of.
Yeah.
It's kind of like the climate of the area at the time. That's why it's like a states' right. And the more southern states, where it's usually traditionally like a larger Christian population, there are not even requests or dockets filled for physician-assisted suicide in the legislature to be voted on. But in the more northern and midwestern states, there are these requests or starts of bills that would go to the state legislators to start this process of making it a law to have physician-assisted suicide available.
What about from the doctor's point of view? They study for years, they take the Hippocratic Oath, not do any harm. How do you think actually assisting someone in ending their own life is affecting doctors? Do you think that's actually breaking the oath that they took?
I think it's breaking the oath, absolutely. One of the first things it says is, first, I will do no harm. And by killing someone, that's exactly what they're doing, is harm to not just that person, but that family. There's effects with that as well. And then also, I think with physician-assisted suicide, the physician doesn't have to accept that request if they don't feel comfortable with it.
Yeah, they don't have to. If they can, I mean, then the person would have to go to another doctor, but they don't have to accept it.
Are there legal consequences if the doctor
Does-
declines or does it?
There's not.
As long as it's
In
the
one of
legal
those
state.
Yeah. There was like cases on that where the physicians were worried that they were going to be like charged with murder or something like that, and they went through it and there was not. They decided that it's just the patient's and it's the doctor's decision if they want to do it or not go through it.
I'm curious as to your view on this with respect to the United States laws about abortion. So, abortion has been legal in the United States for 40 years. And the people that are pro-abortion are usually called pro-choice, that a woman can choose to end what would arguably be another life, that she can make that choice. If we respect that right, and we've respected it for 40 years, why would we not respect a woman or a man's right to end their own life if they can end the life of a fetus?
I think that comes down to the argument of when life begins.
Okay.
And then,
Sure.
and then also, yeah, just when life begins is like, I think that the conversation is that when it became illegal, or when abortion became legal, the thought that
A fetus wasn't alive.
A fetus wasn't alive, yeah.
I'm sorry, I had to step out for a second. So we're relating abortion to PAS.
Right,
Why do we allow that right, but not the other?
Right. Why can you choose to end what would arguably be another life,
Right.
and or at least some sort of being, but not your own? I mean, to me, it seems as though the government would have an interest in promoting physician-assisted suicide. people that are terminally ill are a tremendous drain on the resources of the United States. My health insurance premiums are higher because of terminally ill people. So it seems to me like the government would want to promote physician-assisted suicide, because these people who are interested in dying and moving on, it then costs everyone less. I mean, it seems to me as though there would be that interest. And so I'm just curious if you found things that, is it these Christian principles that come into play that are really dictating why the laws are in place? Or is there some just, deep respect for life that we have to have in the United States, why 45 states do not allow this? I don't know, I'm just curious on it.
I think it is like a respect for life mostly, but I think it also would, if they started promoting it, it would cause like an uproar in the Christian and other religion like around the world. Like they would be like, no, that's not right, you can't, and it would just cause too much drama and all of that coming up that they shouldn't promote it overall. But I think it is deeply a respect for life, so I think that's mainly.
Yeah,
I think, oh, sorry.
No, you're good.
I think the government, like different governments around the world, you don't want to, especially the United States, who is known for freedom and known for life and known for, a government doesn't want to promote killing their own citizens. So I think that's also, it's like what other countries look at you with that.
It's interesting, he hit on something there about the cost differential between prescribing lethal dose versus end of care protection. Matter of fact, I was reading some articles preparing for this week, and I noticed that in Europe, that actually they've seen some of where the doctors are more likely to, in some of those countries, to prescribe the end of life dosage because it's cheaper than letting these people say. So do you know any examples of that? What countries where that's happened?
Where it's cheaper?
Examples where they've seen by legalizing this and by allowing it to happen. Matter of fact, I think there's a couple countries that allow euthanasia in Europe, where there's that slippery slope, as they said, to, hey, it's much easier to take a life than to have. Do you have any examples of that? Are you aware of any of that?
I don't have, I'm not sure if this is going to answer your question at all, but there's an example of a guy called, his name was Greg Ewart, and he had motor neuron disease, and I don't know if that plays along with the whole economy and it was cheaper, but I know with his family, it does show, all the different medicine and things they had to do to take care of him. With him wanting to die was a lot cheaper, if you would say.
And what was the end result with him? What happened?
He did.
He
He
did
moved to Switzerland
Yeah.
to
end his life because he didn't want to. What was his main reason?
He didn't, I think it was,
He was in pain.
yeah.
And he didn't want to suffer anymore.
And he didn't want his life.
one of his quotes he said was, "You can watch only so much of yourself drain away before you look at what is left and said that is just an empty shell."
So what is your problem? Do you have a problem with him doing that, or are you okay with that? And I would like to know your thoughts either way. So if you're okay with him doing that, tell me why. If you're not okay with that, tell me why.
I'm not sure, I think in Bible we saw a video on it, and it showed him getting ready for the day and seeing him to the seconds of him doing it, and it was one of the saddest things ever. So
Yeah, it was
to me,
terrible.
it was sad to see him say goodbye to his wife, and it's just his eyes just closed. To me, that's just not right at all.
So he
I mean,
was
I know it's
conscious,
yeah.
able to communicate.
Yeah, but he couldn't really. I mean, he could move well enough to drink, but couldn't feed himself a full meal. His wife was bathing him. He was just like a vegetable. It was.
What is his so were you okay with him making that decision or no?
I mean, I'm not okay with that just because I don't agree with physician-assisted suicide, but I think that overall, I mean, if you have to do it, if you're going to do it, then I guess that's the best way to do it.
Yes, I don't agree with that course of action personally. I read this letter from a lady named Kara Tippett who was dying of breast cancer over a couple of years span to another person that was dying of brain cancer who had moved Brittany Maynard, who had moved to Oregon.
Yeah,
right?
she moved
to Oregon in order to kill herself. through physician-assisted suicide. And in the letter,